All right, Diana, thank you so much for meeting with me today and agreeing to do this interview. I just wanted to start out with a little bit of background. So can you tell us what your role currently is in your dental office and how you got into the dental field?
I am the clinical manager for Irving Park Family Dentist. We are a corporation of 10 plus offices, including here in Illinois and in Wisconsin.
Wow.
I got into the dental field when I was really young, actually. I grew an interest since I was in eighth grade.
Wow.
Yeah, I know I got that a lot.
Yeah.
And then it was, what confirmed it for me is when I had accidentally chipped a front tooth and I was really uncomfortable. I was 16, where, appearances are pretty much everything.
At
And
that age.
it was a really tiny chip, but I just didn't feel comfortable. So when I went and he put a filling, it completely changed me. Like I got my confidence back. And it was that assertion that that's what I wanted to do. I
Mhm.
wanted to give people that confidence with their smiles as well.
Yeah, that's amazing.
Yeah, thank you.
Yeah. So you didn't have a fear of the dentist that like
No,
most kids at a young age.
no, I actually enjoyed it. The only thing I did not like was the fluoride, but I did not fear going in at all.
Wow. So when you first went into the dental field, how did you start? What was your first position or job?
It was just dental assisting.
Okay.
I did go to school prior, so I kind of went in knowing a little bit.
Mhm.
So it was just, the basic dental assisting the doctor, sterilizing, and then I moved my way up throughout the years.
Wow. So you're proof you can grow within a
Yeah,
dental
of course,
office.
yes.
Yes. Awesome. So what does your day typically look like now? And like how do you help your office kind of stay organized with inventory of products and everything?
Yeah, so it varies, but it's usually starts with checking my texts. I do manage about 10 assistants. So if anybody calls off, I have to see how my day is gonna go now because I do have
Mhm.
a pretty busy schedule. So I do have to make sure that we're still able to work throughout the day, depending on how many assistants call off. Once I have managed that, I do answer my work email, which includes talking to a couple labs. We do work with around 5 labs. So I have to make sure I have answered all their emails or their questions regarding our cases, follow up on
Mhm.
our cases as well. I enter cases once they come in, and we have around 10 to 20 cases come in every single day.
Wow.
So yeah, so I do enter those and I put them away. I check my schedule for the next day, make sure everything is how it's supposed to be, and that I
Mhm.
have everything prepared for the patients coming in. And if by any chance we are short staffed back there, I do get to assist sometimes back there as well.
Do you enjoy going back to that a
Oh yeah,
little bit?
I do. There's days I miss it. I'm sitting in the chair and I'm like, I need to go back there at least just to like feel like I'm on the floor.
Yeah. Yeah, and you get that, I'm sure and it also like you get that patient like interaction
I do,
kind
yeah.
of that inspired you in the beginning to get
Yeah.
into dentistry.
Yeah, I was on the floor a little bit more in the beginning here, and I did establish a lot of really nice relationships with a lot of patients where they still see me walk by and they come say hi, or even if I'm in the office and I see them on the schedule, I'll go say hi to them and we're like catching up and ask me about
Yeah,
their family, they ask me about my family. And it's just really nice to have those kind of relationships with your patients.
of course. Yeah, and it makes their experience like so much better.
Oh
You
yeah, yeah. Yeah, I
yeah.
still have patients that they still ask my provider that they want me to assist them. And yeah, I'll put a gown and I'll go back there and help them out. If they feel
That's
comfortable with
awesome.
me, I want to give them that comfort because I know it can be a scary chair.
Hmm. Yeah, I will admit I worked in a dental office for a while. And I still get nervous even now going to the dentist. It's some things I think you just can't like really help, but you
Yeah.
put things into place like knowing a familiar face
Yeah.
makes the difference
It
like
does. Yeah.
nothing else.
Yeah, exactly.
Wow, that's so cool. Okay, so your office obviously has Zen supplies
We do.
at a couple of your locations, I
I
believe.
think most of them have it.
Yeah.
If not all of them.
So what like type of, do you help manage that at all? Or for the most part, are your assistants like taking the lead?
No,
with
I
the
do
tracking?
all the ordering.
Okay.
I do all the ordering for my office. I actually have a master list that was created actually in your website,
Mhm.
and we were able to share with all of our other offices that master list, so everybody has the same material, because we do have providers that do travel to other locations.
Oh, yeah.
So they do like some materials that we use here. So we just, and that's what's really helpful about your website. We just can send it over on the website to the rest of the offices so they can have it as well.
Mhm. So has it helped you as far as like keeping track of, because I believe your office has the inventory tracking aspect, correct?
Yes.
Can you talk like a little bit, like, has that made your life a little bit easier when like making your order list of items? Because there is that generated like list that kind of helps you get an idea of the items that you're running low on, so you don't, you know, either go out of the items or you don't overspend.
Right. Yeah. So that's really helpful. I do use it, and it's nice to have the little warning like, hey, you're kind of running low.
Mhm.
But I also do have a list as well that I take with me around the office when I'm doing inventory, just to double check. And we do have the system, like if we see we're running low,
Mhm.
we'll go ahead and put it on a board. And then I compare it to what Zen says. Okay, I'm like, it does make sense. We're kind of running low. It's been, a little bit over a month, or we're about to hit that month to go ahead
Yeah.
and order. So it is a very helpful system.
Do you have any advice for any offices that I know some offices struggle with getting some compliance as far as like zenning an item out or marking that they took something from their inventory? Do you have any advice on that aspect?
Um, I think you just have to be aware of how much your office is using at all times. Um, and there's not every month is going to be the same. I mean, I've
Mhm.
had months where I'm doing more root canals, and I know if I'm doing more root canals, that means in a couple of weeks I'm going to be doing more crowns. So I
Mhm.
know I have to stock up a little bit extra on that aspect, like on that procedure, like impression materials, impression trays.
Yeah.
And that way, I think this has helped me to never really run out of stuff. I do order just a tiny bit more extra, just
Mhm.
because I know when I'm ordering, depending on the company I'm ordering, it might take a little bit while for us to get it in the office. So I do have my assistants as well let me know when I'm about to hit that, hey, we're down to 3.
Mhm.
They know that once we're down to 3, we have to write it on the board and they have to inform me, so I can keep a closer eye on it, just to
Yeah.
make sure we're gonna make it to the rest of the schedule without having to order before our actual orders do.
Mhm. And that's awesome that you're able to then kind of analyze and look down the road and know you're going to need more of a product because, like you said, like you just did a ton of root canals, so you know that crown is coming. So
Yeah.
make sure you have those supplies for those patients and there's no delay. That's part of why your office is so great.
Yeah, thank you.
Yeah, of course. Okay, so I want to get back to a little bit of your role when you first got into dentistry and assisting. So we've kind of been thinking of this idea like, how can dental assistants move forward and really grow within the dental office? And is it possible for assistants to make, like $45 an hour? What skills do they need to kind of get that pay so
Mhm.
that, which is kind of along the lines of basically being paid as a hygienist, maybe. Like,
Right.
how can they show their, I don't want to say worth, but show like, hey, like I deserve this money because like I'm doing X, Y, and Z within your office. I'm a real asset, like,
Right.
you know. So what getting like a dental assisting certificate or going to school, do you feel like this really helps push you a little bit further?
It does. I feel like it, like I said, I went through an intensive course where I was certified. It did help me in the fact that when I went into an actual job, I already knew how to take x-rays. I already knew how to take impressions, to pour. I knew at least some of the material, but I knew the steps because everybody uses different things. Every office is going to use different materials from different brands. But at least I knew the steps for every procedure. So that's what helped me. And then you never know, and every office is different. You might go in where you might be the only dental assistant. And if you're not prepared to at least know the basic, it's going to put you back a little bit. So it just depends on the person as well, on how fast they learn. I've had assistants here that we've had to train from scratch, like literally like explaining to them the tooth anatomy, the tooth surfaces. And I've had assistants that pick up really fast, and about 3 months they're good to go. And then there's assistants that they're like, you know what, I can't work like this. I prefer to be in a classroom where somebody's showing me, and I'm taking my time, and it just depends.
Yeah.
But yeah, I feel like a lot of certifications do help you out. There's a certification for sealants and prophylaxis that gives you an extra step to be, hey, I'm certified in this. I can do this extra for office, where the doctor can go do somewhere else to produce something else, and you're helping them make that production with just the assistant being there.
Yeah.
So the more they the assistant prepares themselves, the more certifications they have, the more knowledge they have in their field, the more more valuable they are, and the more they can produce by themselves and have the doctor go on and do something else to work on a different procedure.
On average, do you know like how long was that dental assistant like certificate program? How long were you in?
Mine
Cool.
was 8 weeks. It was an intense course of 8 weeks. It was a Saturday. I remember from 8 a.m. to 4 p.m.
Wow, yeah, all day then.
It was an all day. It was an all day course, yeah. Because I
Wow.
know typically they are 16 weeks, I believe now. So yeah, but that was years ago.
Yeah.
I think years ago that.
Yeah. Do you think that offices should invest in their dental assistants and maybe like do certain certificate programs, like maybe using like technology, like sending an assistant to learn like the CAD CAM, like how to scan a tooth so that you guys can like make crowns within the office?
Oh,
do you think like there's value in dental offices putting that time and like money into their dental assistants?
Of course, because that if you invest in your assistant, you're also investing in your office because she'll be doing that for you. So yeah, it's definitely worth it.
Yeah. Okay. And do you think dental assistants can get maybe not like that $45 an hour, or at least more, to be more sustainable and more again, like I don't like saying the word value or like worth, but being seen as a producer, kind of like hygienists are, right? Like, do you think that dental assistants can make that 45 an hour?
I feel like as a dental assistant, just as a dental assistant, you can't. Just because we have to take, because our minimum wage is still like at 17, which is, it's gone up from when I started. But I feel just as a dental assistant, we can, and especially in Illinois, we're very restricted in what we can do to help out in our office. I know we just had a couple of certifications that were passed, like scaling, but I still feel that we can't reach where a hygienist is still going to be able to make that amount of money. As a dental assistant, you can definitely work your way up in the ladder and learn as much as you can, not only about dental assisting, maybe be cross-trained with the front,
Mhm.
And you can let your provider know, like, I'm doing the job of two people, I'm helping you with what two people can do, and you only paying one. So they might be able to pump up your salary a little bit more.
Mhm.
But I don't think we'll be just as a dental assistant at 45. I think it's a little high.
Mhm. What
So,
do you think like there's different levels to dental assisting? So like I know some offices, like you mentioned, like most private practices maybe have one dental assistant,
right.
maybe two, depending on how
Yeah.
many doctors there are. But then you look at like corporate dentistry who maybe have like five dental assistants because they have more doctors there, or whatever it might be. Um, do you think there are different like levels to dental assisting where like maybe you could argue like the higher pay because you are now managing assistants lower than you, or you're teaching them maybe like the skills?
Yeah, there's different levels. Like I said, when I first started, I was dental assistant, which all I did was pretty much what I was taught in school: take X-rays, bring the patients in, set up, charts, sterilize instruments, and that was my whole day, every single day. I moved up to the main dental assistants, where you have a little bit more responsibilities. You're responsible of um, ordering, you're responsible of maintenance for the whole office. And then I became a clinical manager, where now I'm in charge of other assistants. I'm still in charge of the whole office, make sure it's running properly. If something breaks down, I'm responsible for calling the company, make sure I schedule something for them to come in. I'm in charge of all lab cases go through me.
Mm-hmm.
I'm the one that handles all lab cases, calls with everybody, every single lab case. I'm in charge of making their schedule now. So there are levels to that, and with more responsibilities you have, you do have that argument that you deserve more.
Mm-hmm. I mean, it comes to, I think, with like your drive and your work ethic, like that
Right.
gets you there.
Of course, yeah.
But did you have a mentor, anyone in the office that kind of took you under the wing to like teach you more or anything like that? Or was it maybe the doctor?
I did have great doctors that taught me a lot of things, and you do need those providers with you, because they're the ones that are going to show you and teach you as you start moving up. Um, for clinical manager, when it comes to ordering and try to maintain everything, I had some great assistants help me out. As they were moving on, they would show me, this is what you need to do.
Mhm.
And I also learned on my own sometimes. If I'm making mistakes, or, trying out things. Um, you learn as you go sometimes. And then there's always people, if you're lucky enough, like I was, to have people help you out as well.
Mhm. Yeah, I think it takes like almost like a combination. Obviously,
Right.
like your drive and your work ethic, but also like those people who are there to help you learn and grow. Definitely
Exactly.
key.
Yes.
Mhm. How does the hourly rate wage of a dental assistant, do you think like compare to other positions within the dental office?
I think we're still, like I said, it's definitely changed from when I started. At least the minimum wage has gone up double from when I started.
Do you mind sharing where it was when you started?
It was $8. I started at $8.
Hmm.
Yeah, that was a minimum wage back, I think, in 2006, I believe.
Okay.
Yeah.
Wow. So it
Yeah.
has grown.
It has grown. Yeah, yeah, yeah. When, I was because we had a couple interviews, and we were looking at the minimum wage, and yeah, I'm happy, because it's a very demanding job to be a dental assistant. We're always on our feet, we're always running around.
Hmm.
Um so I'm glad it has gone up. But I still feel like we're still not up there compared to the rest of the positions, like you have said, hygienists.
Hmm.
So I feel like there's still more room for our position to grow, and I'm just glad we're giving the opportunity, because there's a lot of things now as a dental assistant you can do that we didn't have that opportunity when I started.
Hmm.
Pretty much back then it was just polishing and sealants, and now We can do scanning. We can fabricate night guards. We can retainers, and that also helps our career get bumped up a little bit as well.
Yeah, absolutely. And I want to say too, like you hit on a great note. Dental assistants you are on your feet all day. You are in and out of like dental ops, going from one to another, maybe handling two patients almost at once.
Yeah.
What advice do you have for dental assistants for one, I guess I want to start with managing their day, but also to managing the stress and the toll it might take on their bodies a little bit.
Right. Yeah. Well, like I always try to look at my schedule the day prior just to make sure how it's gonna go and start planning out, not only with my staff, but also as well with my providers.
Mm-hmm.
I think that's a major thing, and it also helps with your providers. We're lucky enough here that we have a lot of providers that understand. Um, There sometimes we do have to be running around, and they're willing to work by themselves, and they'll be okay. I got this. You go get the other patient and come meet me when you're done. Like don't take your time. So
Mm-hmm.
I think that's also very important when you do have your providers supporting you and helping you out on that aspect. As for stress, you can let it get to you, right?
Mm-hmm.
It's like I told the rest of my assistants, you guys have to come here. I understand there's a lot of stress going on outside of home, and it's best if we don't bring it here because we spend most of the days at work more than we
Yeah.
do at our houses sometimes. I spend more time with you guys than I spend with my family. And I don't want to bring anything, like it's already stressful enough sometimes here with you have a lot of personalities with your patients, you have a lot of personalities with your providers, with your front desk, with your staff in the back, your assistants, and it just makes it easier for us to be happy. We're always trying to joke around back there just to lighten up the day. And
Yeah.
I think that's what really helps us get through the day. And, we always try to joke around, try to make somebody smile. We're like goofing around back there as well sometimes. And it just helps our day just go by so much smoother.
Right. Because it kind of goes back to like you could plan your day, but in the dental office, like
You never
either,
know.
yeah, exactly. You could try and plan, but it might not go as you planned. And you might have a patient cancel last minute or an emergency case. And I think having a good office camaraderie and like support system to where you can joke and be playful like with your staff makes a huge difference for like those unknowns that come up
Yeah,
during your
of
day.
course. And I think also what has helped us is we try to get together out of work as well, because being in the office is one thing,
Mm-hmm.
but going out and actually loosening up and getting to know somebody else a little bit more has really helped us come together a little bit more back here.
Yeah, I think that's a great point too. You get to know people outside of work, what their lives are actually like, what they
Yeah.
maybe go through, what their family dynamics are, and getting to know someone can make working with them easier. I
Yeah,
guess
of
if that
course.
makes
Yeah.
sense.
Yeah.
Yeah. Okay. That's awesome. Let's see. Is there a difference in pay, do you think, with dental assistants from like a private practice to corporate or like a government clinic office?
I do. Yeah. I've actually worked for both a couple private offices and I work for a couple corporation offices as well.
Okay.
And I do feel that private offices can offer a little bit more. If not, they can kind of balance that out with benefits sometimes. They're able to give a little bit more because maybe they don't have as much staff
Mm-hmm.
as a corporate office. Like you said, here I have 10 girls, just 10 dental assistants, plus we still have front desk and we have providers and we have call center. So it's a little bit harder to give everybody the amount they want
Mm-hmm.
compared to a private office where maybe it's just one provider and they don't have to distribute that salary as much or stretch it out as much as a corporate office has to.
Mm-hmm. Makes sense. And do you feel like because for example, your office has like 10 dental assistants, what does like downtime look like for them? Or is there like never any downtime?
Downtime does happen. It's rare, but it does happen. They already know we do have a list back there of reminder when, there's downtime. We have to take advantage because it doesn't happen very often. We have to make sure our rooms are stocked up. We have to make sure we're checking lab cases. We're checking next day, pulling out lab cases for the next day. So we're not rushing last minute trying to find our cases. So they already know that we're supposed to clean the office, reorganize, make it tidy, and they do a great job. I don't have to be behind my staff the whole time. They already know, okay, we're downtime. Let's start organizing the composite tray. Let's start stocking up our sterilization area, our rooms, make sure everything is ready to go. When we do get busy, we're not running in and out of our rooms because we don't have what we need.
Right. Yeah. So I like that idea of having that list. So like if there is, say, a patient that cancels and they have like an hour, they can look at the list and see what needs to get done.
Yes.
Great. And then as far as like cleaning, because we had talked about this, I think we may have tried to write some type of article or questionnaire for our dental assistants if they clean their office, like what that looks like. Like, are they cleaning the floors? Or like, do most offices, do you think, have like a cleaning service for that? Or is it left up to the assistants?
No, so we do have a cleaning service. She comes 3 days out of the week. The rest is we have to do it. So it does involve, we wipe the whole room down. We broom. We throw out garbage. We try to tidy up everything back there. We do try to mop every single day, especially because there's stuff flying all over around. We do try to mop as much as we can, and we do have, like I said, we have a lot of us. We do have a big office. It's a 10-op office, so we try to maintain everything clean, even in between. Not even at the end of the day, in between patients.
Yeah.
If we're taking impressions and impression materials, when you take it out, there's stuff flying all over it. We do grab the broom and we clean out and have it as clean as we can for the next patient.
That's awesome. With assistants like doing all of that, do you see any industry like trends that are changing with dental assistants? I feel like you did touch on this with saying they're able to do a lot more than obviously like when you started, when it was more like polishing and like chair side for the doctor. You're able to now help make like retainers or like night guards. Do you see the future of like dental assistants going up, like as far as like responsibility and the more that they can do within like the op?
Yeah, of course. Like I said, I have doctors here, and like I said, it just depends on the state you're in. I know here in Illinois we're very restricted still, and hopefully I hope it changes, because it will open up a field. And there's a lot of assistants out there that know how to do a lot of things. They want to learn to do a lot of things, and we're very limited and able to do that. But yeah, I mean, like I said, yeah, CEREC, CAD/CAM scanning. I know in some states they don't let you drill, but they let you fill. In a lot of states they let you cement permanent crowns, do a lot of things that we're not allowed here. But I hope that in the future Illinois changes and allows us to do a lot of things. And I do feel like this field can grow a lot, and we can be a lot more useful than we already are in the office.
Yeah. I honestly didn't realize that the laws and rules like depend on the state that you're in. Have you worked in a different like state besides Illinois?
I haven't. No, I do have a lot of providers that come from a lot of states, and I know where she was at. She was like, my assistants back there were able to fill. I'm like, we can't do that here. I'm like, we're not allowed. We have to be allowed by the state, and we're not allowed to do that yet.
Yeah. So a little shift for that doctor then.
A lot of shift for that doctor, yeah.
When they came to Illinois. Wow. Okay. Okay, so lastly, I kind of just wanted to end, if you have like any steps that a dental practice can take to ensure they are paying their dental assistants fairly, while also obviously managing the budget they have to pay for their dental assistants.
Yeah, I mean, they just have to make sure, look at the minimum wage. They're looking at where their area is located, because depending on the area, it also depends on how much an assistant should be getting paid. Experience. You have to value the experience that that assistant's going to bring into your office, that knowledge that it can also help you out as well. You have to look into the benefits, what you're providing. If it's going to be, maybe you're not able to give that assistant what she wants, but you might be able to help her out with benefits that maybe another office might not be able to offer her. You have to look into your production, see if your production, it once you've established and separated everything that you need to, your office needs to pay, if you're able to give that assistant, like you said, her worth, we'll quote it, worth, because she is going to be a value to your office at the end. She is going to help you make money as well if she knows what she's doing. So that's something they have to take into consideration as well. You're just not paying somebody for their job, but you're paying them for their knowledge and how they're going to help you produce as well. And just make sure that the rest of your staff, you have more staff, they're helping you keep that cost down. They're working according to standard procedures established by the practice in order to avoid misusage of material as well, resources and time, to maximize the production of your office as well. I think that's very important.
Yeah. Okay. Any other last minute advice you want to give dental assistants? Good shoes for them to wear while moving.
I wear Converse.
Yeah.
I feel like, and it's changed a lot too, because I remember I used to wear Converse when I first started, and a lot of providers didn't, a lot of offices didn't allow that. But now I think it's changed. Just wear whatever you're comfortable with, whatever, it's like I said, we're standing most of the day and our feet are going to hurt at the end of the day. So just try to wear anything comfortable. And my advice to all the dental assistants would be, don't stay stuck as just, like I tell my girls, you're in there not just assisting, you're in there to learn and help out, and always try to be not only one step ahead of your provider, but two. And don't be afraid to ask your provider out of the room, why did you do this? Or could we done something else? Oh, I always try to learn something every single day from my provider, or something from the office, something new all the time, just to help me get that step higher. The more you know, the better, and it's going to help you out more in the future.
Absolutely. Okay, great. Thank you so much for taking this time. I really appreciate it. And I'm sure our dental assistants who listen to this are going to appreciate it too. So thank you.
Thank you. Thank you for having me.